Welcome to the video. Today we're going to talk about the things I wish I learned in PT school. Now, to give a disclaimer, I did in fact learn some of these things in PT school. However, I think that school and our profession as a whole should place much more emphasis on what I'm going to talk about here in this video. I'm going to talk about the soft skills. Those things that are hard to measure and sometimes hard to practice. But at the end of the day, the things that are really, really important for excellent patient care and outcomes. Like I heard from someone much wiser than myself, soft skills have hard consequences. And with that being said, let's jump into the things that I wish I learned in PT school. First, words matter. Sticks and stones may break our bones, but words can do some serious damage too. As healthcare professionals and physical therapists, we're trained to look for the things that are wrong. We're trained to look for problems, impairments, deficits. And while those things are important, it can leave us missing the things that are right. It can cause us to overlook and underemphasize the positives. And in my opinion, that's a mistake that too many clinicians make. The patients that are entrusting us with their care are in a vulnerable place. They're probably coming to physical therapy because they have some issue that is limiting who they are. And it's our job as healthcare professionals to empower, encourage, and reassure the people that we're treating. One way to do that is with the words that we use. We are in a perfect position to lift people up and build resilience with language. Now, I can talk about this topic for hours, but for the sake of this video, I'm going to leave it here. Just know that our words can be used to encourage, to inspire, and to build resilience in the people that we treat. All of those things are associated with more positive outcomes, and that shouldn't be a surprise. So, next time you're interacting with a patient or just a friend, choose your words carefully because they matter more than you think. The second thing that I wish that I learned in PT school was how to embrace uncertainty. I mean, if there's one thing that I learned since being out of school, it's that as physical therapists, we don't have all the answers. And sometimes we don't have most of the answers. Our profession is full of gray space, and that can be hard to navigate. To make things even more challenging, the people coming to us are often in pain, maybe feeling vulnerable and potentially suffering. And all of that uncertainty can be a big burden for the person in charge, you. However, it's important to realize that even when we don't have all the answers, even when we might have no clue what's going on, we can still make a positive difference for the person in front of us. We can still choose to have confidence even when we don't feel confident. And we can do that because we have the choice every minute of every day to be present, to be compassionate, and to truly care for the people in front of us. If you're unsure what to do next, just do the next right thing. If all else fails, fall back on being a good human being first, and being a good healthcare professional will follow. And our job as healthcare professionals isn't to fix anybody. That's a lot of pressure and an unreasonable expectation. Our job is to be a guide. And that brings me to the third thing that I wish I learned in PT school. Meet people where they are so that you can take them to where they want to be. This world is filled with so many different people with so many different world views. We're all coming from different places with different perspectives. It's so important as healthcare professionals and people in general to meet people where they are, to drop expectations and to truly do our best to understand where the person on the other side of the table is coming from. Once we can understand where people are in their lives, we can guide them toward where they want to be. At the end of the day, whether you want to believe it or not, Outpatient, especially physical therapy, is a customer service profession. It's a profession where our job is to help people get back to the things that they want to do and to be the people that they want to be. This point blends into the fourth thing that I wish I learned in PT school. Know them. Be interested in your patients. Care about your patients. That's such a hard thing to teach and such a hard thing to learn. But at the end of the day, when we truly care and understand the people that we're treating, when we're interested in them and invested in their outcomes, things just go better. What's important to our patients should be important to us, and we don't know that until we know them. Just like using the internet, if there's no connection, then the rest doesn't matter. We as healthcare professionals have to invest intentional time and energy into building a strong connection with our patients, because we need to let them know that we care. And like it's been said, people don't care how much you know until they know how much you care. Bear with me here for a minute, because I want to take this just a layer deeper. Beneath our titles, beneath whatever career or activity our patient does or wants to do, we're all human beings. And there's just so much value in being there for another person on a human level, not just a healthcare level. So the fifth thing that I wish I learned in PT school is not everybody is going to get better. And not everybody is going to even be the right fit for you as a therapist, and vice versa. It's a hard lesson to learn, but it's an important one, because it can get really discouraging when you're not seeing the progress that you think you should be making. Sometimes that's the way it is, and that can be really hard to accept, but we have tools in our toolbox to handle that. We can always refer out, we can always take breaks, and there might be nothing more confident and courageous than being humble enough to admit when we're not the right person for somebody else. But that doesn't mean that we can't leave people better than we found them. Even if somebody doesn't get better from an outcomes perspective, we can always leave people more encouraged, more inspired, and more resilient than when they came to us. Remember, our words matter, compassion matters, and our relationship with the patient matters. There's something to be said for being there for another human being, even if we're not making the physical progress that we wish we were making. So the sixth thing that I wish I learned in PT school is that it's different. Pain and suffering are different. Pain has been defined as an unpleasant sensory or emotional experience. Suffering is a layer deeper. It's how we respond to pain. And as physical therapists, we can recognize the difference between pain and suffering. And part of the power that we hold and the privilege that we have in interacting with patients is that we're in a position to reassure and reshape perspective. Because at the end of the day, we are the stories that we tell ourselves, and when patients come to us with a certain narrative, we have the privilege and the power to help them reshape it in a way that works better for them. Because pain doesn't have to mean suffering, and not all suffering comes from pain. So it's another gray area in the world of physical therapy, but it can be helpful to differentiate and even just be aware that pain and suffering are two very different things. And anybody who's treated patients for a while can tell you that there are people who are in a lot of pain and aren't necessarily affected too much by it. And then there are people who have lower levels of subjective pain, but they're suffering for one reason or another. And it's worth recognizing and understanding. Yeah, that's about it on that one. The seventh thing that I wish I learned in PT school is just make people smile. I mean, as physical therapists, by nature, we are interacting with people who aren't feeling like themselves. And there is so much value in a simple smile. You never know what someone else is going through underneath the surface, and it doesn't hurt to just help people smile, to be an encouragement, to be positive, to be uplifting. There's value in that. If you can't do anything else for a patient, just make them smile. The 8th thing that I wish I learned in PT school is to listen more. As my great-grandfather used to say, you have 2 ears and 1 mouth. As healthcare professionals, it's important because the people coming to us have a story to tell. And oftentimes in healthcare in general, people don't have the time or space to tell that story. It's important that we create that for them in an environment where we're actively listening and interested in what they have to say. So listen more, talk less, and see what happens. The 9th thing that I wish I learned in PT school is that you have to take care of yourself. As healthcare professionals, we give a lot of us to the people that we serve, but at the end of the day, you can't pour from an empty cup. So take care of yourself and be proactive about conserving your energy. Sometimes you have to be selectively selfish so that you can be sustainably selfless. And now the 10th and final thing that I wish I learned in PT school, and this one isn't so much of a wish because I learned it. It depends. It always depends. I can't tell you how many times in PT school I heard that phrase and rolled my eyes, and now as a clinician I can't tell you how many times in the clinic I have uttered those same words to a patient. It depends. There are almost never absolutes. Black and white rarely exists in the clinic. It's often gray, and what worked for one person might not work for another. So as much as we might like to believe that physical therapy is a hard science, I would say it's much more of an informed art. And yeah, it depends. And so to wrap up this video, I want to leave you with 2 of my favorite quotes. The first is from Albert Einstein, and he once said, "Not everything that counts can be counted, and not everything that can be counted counts." Just remember that these soft skills have hard consequences. And while we might not be able to necessarily measure how much we listen or how much we care, those things are truly important. The second quote is from Paul Shakespeare, and he once said, "You might not be able to change the world, but you can always change the world for one person." That's all I got for you right now. And I hope that it was valuable for you, whether you're thinking about physical therapy as a profession, whether you're a student currently studying physical therapy, whether you're a physical therapist, or even a patient. These are things to look for in a person who's going to care for you. And I wouldn't expect or accept anything less. I want to give one disclaimer here that this video is by no means in any way medical advice. So, yeah. Thank you guys so much for watching. If you enjoyed the video, please hit the like button, subscribe to the channel, and maybe tell 1 or 2 of your friends about it. It really helps me get stuff like this to more people like you. I appreciate you. I hope you have a great, great day, and I'll see you next time. Thanks again. And one more thing. If you want to continue this conversation or ask a question or argue with anything that I said, let's do it. Leave a comment below, find my contact information on my blog, and reach out. I'd love to continue this conversation, hopefully in a way that's productive and moves our profession and relationships forward. So yeah, reach out. Thank you guys.